Okay, so today let us start the session with find the reason for yourself. The day when we had discussed niacin, we were left with certain questions to ponder upon. Why there is maize and sorghum eating population have niacin deficiency? Okay, and maize has niacin. Still, why maize eating population has deficiency? Deficiency of pyridoxine and riboflavin can cause pellagra-like features. Why is that so? And niacin as therapeutic agent for hyperlipidemia. How is that possible? So let us now try to answer these questions. First and the foremost, what happens to these maize or sorghum eating population? One of the reasons, especially in sorghum eating or jowar eating population and maize eating population, is that they also have high levels of leucine. And leucine is an amino acid which is known to inhibit conversion of tryptophan to niacin. You already have learned in the previous videos that tryptophan, an amino acid, can be utilized to synthesize niacin, the vitamin, or niacin vitamin. Basically, it does so by converting quinolinic acid to nicotinic acid. And hence, because of this high quantity of leucine causes niacin deficiency. But wait a minute, didn't we say that maize, however, has got niacin? Then why, in spite of having leucine, okay, fine, it is understood that tryptophan does not get converted to niacin. But what about the niacin content present in the maize? So when the maize has got good concentration of niacin, why there is niacin deficiency in maize eaters? Yes, maize has niacin or niacin in the bound form, but it is not freely available. It is not easily digestible. It needs to be hydrolyzed. And it is not possible in the body to do that. So there is a pre-treatment for these maize if it has to be made niacin-rich food. They need to pre-soak it in alkali before they mill it. This is called as nixtamalisation, and this is known to increase the bioavailability of niacin. But wherever it caused the deficiency, most of the places, this pre-treatment or pre-soaking in alkali was not followed. Why would deficiency of pyridoxine and riboflavin cause Pellagra-like features, and why? If you closely remember during my last video on niacin, I had already said that you can synthesize niacin from tryptophan, but it also requires participation of other two coenzymes, which is PLP, and also requires FAD, right? And PLP is pyridoxal phosphate, which is obtained from the water-soluble vitamin pyridoxine, and FAD is obtained from riboflavin. So because of this, even if you have deficiency of pyridoxine or riboflavin and have good concentration of tryptophan, you still may suffer from pellagra-like condition because of deficiency of other two vitamins which play a role in synthesis of niacin. Well, niacin as therapeutic agent for hyperlipidemia. According to certain studies, niacin is directly as well as non-competitively known to inhibit hepatocytes 1 enzyme, which is called as diacylglycerol acyl transferase 2. Its main role is in triacylglycerol synthesis. Obviously, when the liver is unable to synthesize this triacylglycerol, it will start getting inhibited, and all the hepatic apoprotein B, which has been synthesized by the liver to generate the lipoproteins, mainly VLDL and LDL. Remember, lipoprotein is made up, has an important component which is also called as apoprotein, and VLDL and LDL have got this apoprotein B, and when obviously there is no triacylglycerol being synthesized in the liver, and obviously there is no need for transport vehicles, lipoproteins to be generated, and all lipo gets degraded. Hence, there is reduction in VLDL or LDL. This is one way, one of the reasons. There are many speculations. There are many theories also put up to explain the role of niacin as a therapeutic agent in hyperlipidemia. And not every theory has been proved so far, but yes, it has been shown to definitely cause decrease in the lipid content. Not only that, the best part is it has been known to increase the HDL concentration, which is supposedly the good cholesterol. It is also seen that it is beneficial mostly in cardiovascular coronary artery disease patients because it is known to increase the vascular endothelial cells redox state, right? Because of doing this, it will reduce the oxidative stress and the vascular inflammatory markers, vascular inflammatory genes production, and thereby reducing the cytokines. So indirectly, it is helping in reducing the extent of atherosclerosis. All these topics of vitamins or any topic in biochemistry, though we study in a staggered way, they make more sense when we have actually gone through the whole syllabus once. Only then we can actually, actually make the puzzle complete. It is like a jigsaw puzzle when we are reading it scatteredly. But once you are aware of the lipid metabolism, you are aware of lipoprotein metabolism, you will appreciate the role of niacin and the triacylglycerol synthesis, how it inhibits and all much better. The take-home message for niacin as therapeutic agent is one, yes, it inhibits synthesis of triacylglycerol in the liver as well as increases the degradation of apoprotein B100, thereby reducing VLDL, LDL particles. It also is known by unknown mechanisms to increase HDL. And last, it is known to prevent oxidative damage to the vessels, which is one of the major roles in the atherosclerosis formation, and hence it has its own place as a therapeutic agent in hyperlipidemia. However, it has a one side effect at when used at a very high dose. When you want to have the effect of hyperlipidemia treatment, then the therapeutic dosage is also pretty much high. At this particular dosage, sometimes people definitely experience flushes, the feeling of warmth, sudden warmth and all. And this is definitely experienced, and this has been postulated to be because of stimulation of prostaglandin D2. So most of the doctors prefer to give aspirin at least half an hour to 1 hour earlier before they start the niacin dosage. Okay, so that was it about niacin. So thank you.